Hi, my name is Aliyah and I'll be doing my newborn assessment. This is my 3x5 index card, front and back. Okay, I will begin my assessment by washing my hands. I'm going to enter the room. I'm going to introduce myself to the mother and let her know that I'll be performing a newborn assessment on her baby or the father, whoever's in the room at the time. I'll start by checking the wristbands, making sure the mother has hers, and that they match the baby's, checking to make sure where they're at, if they're correct. Also assessing to see if the sensors are working. And then along with that, I'm going to check to see what the mother's history is as well. I'm going to see if she had any positive of GBS, any meconium stained fluid. Also, during this assessment, I'm also going to maintain thermoregulation. Along with the meconium stained fluid, I'm going to assess to see if the mother was if she had gestational diabetes, if the baby was SGA or LGA. I'm also going to check what the baby's APGAR scores were at delivery and making sure they were within normal limits, making sure the baby's still adjusting well. I'll also check to see if the baby's blood type is in yet, to assess for the need for a ROGAM for the mom. And then at this time, I'll assess the vital signs. So with that, I'll assess the heart rate, and the heart rate should be from 120 to 160 beats per minute. The respiration should be between 30 to 60 respirators per minute. And then the temperature should be 97.7 to 99.5 degrees Fahrenheit. And I will check the temperature axillary, but first I'm going to assess the heart sounds, the breathing, and then I'll do the temperature. That way, since the baby is at a calm state, I'd like to get it done first. And I'll assess the heart rate and the breath sounds for a minute. And I'll make sure there's no presence of a murmur, and that the rate and rhythm are normal. For the infant, I'll check the lungs anteriorly, laterally, and posteriorly, making sure that they're effortless. There's no use of accessory muscles, that there's no grunting or anything like that. I'll check the axillary temp, like I said, making sure that's within normal limits, making sure I'm maintaining thermoregulation throughout this to prevent cold stress. And then from there, I will assess the baby's head. So I'm going to check the overall shape, checking for the presence of molding, acephalohematoma, or caput. I'll also assess the suture lines, making sure that they're proximal, not overlapping. And then I make sure that I'm going to assess the fontanelles anterior and posterior, making sure that they're flat and soft, not bulging or sinking. I'm going to make sure I put the hat back on to make sure I can maintain that thermoregulation. Then I'll bring it down to the face, making sure that it's symmetrical, equal and bilateral on both sides. I'm going to check the eyes, make sure that they're in within normal placement on the lateral sides of the midline. I will assess to make sure that there's eye movement and that the eyes are moving. Also assessing if there's any drainage coming from the eyes. And then I'll also assess the nose, checking for patency. I can use the bulb syringe for this. Checking for any nasal flaring. Making sure that the nose is midline. I'll also check the ears, make sure that the top of the ears matches with the outer canthus of the eye. Checking for any anomalies or abnormalities with the ears. And then also while I'm up here, I can assess two of the reflexes by rubbing the cheek. I can assess the rooting reflex, which is to be able to turn his head in a sense of searching for a feed. I can also assess the hard and soft palates along with the sucking reflex by obviously putting gloves on and inserting my pinky upward like that, feeling the top and bottom, making sure that they're intact, making sure that the tongue is freely movable and that the baby is able to get a good suck. Checking the lips to make sure they're pink and moist, as well as the tongue is pink and moist. Also, I will check and make sure I have the results of the hearing screening, and if that wasn't done yet, to do that. And then I'll move down to the neck and assess for range of motion, making sure the baby's able to move its head from side to side and all around. Checking for webbing. There shouldn't be any presence of any webbing. And then I'll move down to the arms. I'll assess the clavicles, making sure that they're intact, because sometimes with delivery they can break. I'll assess the arms for muscle tone, making sure that they're moving symmetrically, that they're not flaccid. I'll check the brachial pulses at the same time, making sure that they're palpable, equal, and bilaterally. Moving down to the hands, I'll check to make sure that there's 5 digits on each hand. I'll assess the palmar reflex by inserting my thumb right at the palm of the hand. The baby should grasp it. Then I'll also check for the startle reflex. So I'll put the baby's arms up like this, pull a little bit, and wait for them to give like a slight flexion and a pull back. So that way both of them are intact. And then I'm going to reference my card. Okay. Also in the hands, while I'm checking them, I'll check for the palmar creases, and then I'll move down to the chest. And with the chest, I'll make sure to note the number of nipples. There should be 2. Note that they're lateral of the midline. On each side, notice that the size of the breast budge, which should be around 6 millimeters. I would note I could also, if I didn't assess before, assess to make sure that the respiratory rate and rhythm and the anterior, posterior, and laterally, that they are clear with no adventitious sounds. I'm going to make sure that the chest and the abdomen rise and fall at the same time. And then I'll move down to the abdomen. With the abdomen, I'm going to check the umbilical cord, check for 3 vessels in the umbilical cord, check for any redness, dryness, signs of a hernia. I'll listen in each quadrant, starting with the right lower quadrant. moving my way up to the left, to the right upper quadrant, and then the left upper quadrant, and then the left lower quadrant, making sure that I hear vowel sounds within 5 to 15 seconds in each one. I'm going to make sure I check for any masses or distension. Like I stated before, I would also check for the hard sounds to check if there is a presence of a murmur, which there should not be. I would assess this for a minute on the newborn. And then I'll go down to the legs. I'll assess the length and make sure that they're symmetrical in length. That there are 5 digits on each foot. I'll check the tone, the muscle tone, making sure that they're not flaccid, checking for the plantar creases to see if they're present. I'll also check the Babinski, and while doing that, it's kind of like doing a question mark on the foot, checking to see if the toes fan outward, which would make it positive, which is this is normal in babies for the reflex. Also then putting your thumb at the underneath of the toes to see if the baby's grasp, to check the plantar reflex. And then at this time I can turn the baby around to check the gluteal folds to make sure they match equal and bilaterally, see if they match up on each side. And then while I'm back here, I'll just check the baby's back, making sure that the spine is straight by inspection and also palpation. I'll check to see if there's any dimpling, sinuses, or a tuft of hair at the base of the spine. And then at this time, I'll lay the baby back down. I will then put a new pair of gloves on, and I will assess the baby's genitals. If I did not state before, obviously I would assess the age and hours and the gender of the baby. And the gender of the baby is in fact female. So while doing the genitalia inspection for the female, I'll make sure to note that the female has a clitoris, the labia minora and majora, that they have a vaginal opening. Also the placement of the anus. And then at this time, while I'm checking inside the diaper, I can check that if there was a urination, if there's any uric acid crystals or any pseudomenses, which is normal in, the pseudomenses is normal in baby girls after they're delivered. I can also check for the presence of stool, if it's meconium or transitional. And then while the diaper's down, I can also assess the femoral pulses, making sure that they're equal and palpable bilaterally. And then at this time I can change the diaper. And then throughout the whole assessment, I'll be assessing the skin, making sure there's no rashes, no lanugo, vernix, or any signs of birthmarks, abrasions, or any markings. And then I'm going to reference my card. Okay, so in the assessment, I forgot to mention in the abdominal assessment if it was symmetrical and bilateral on each side. I'm not sure if I forgot to mention to look for the plantar creases to see if they're present, as well as coordinating the baby's weight with how many diapers the baby has gone through. And then at this time, that would complete my assessment. I'd make sure I swaddle the baby back up, making sure that they're warm, take my gloves off, wash my hands, and document any and all of the findings. Thanks.